Welcome, everyone. We're here today to learn about headaches. And with me, I have one of our neurologists from the Neuroscience Institute, and I'm going to ask him to introduce himself.
Hello, my name is Alexei Shikuyev, and I'm one of the neurologists here at Valley Medical Center. I'm specializing in treatment of headache disorders.
Let's start with our first question. What are the main types of headaches and what are their differences?
Well, generally speaking, all the patients that we see in our clinic can be roughly divided in two large categories. We see patients with so-called primary headache disorders. That's when we cannot find any underlying primary medical condition causing the headache. And then we see patients with secondary headache disorders. This is when the headache is caused by either an injury to the head, it could be trauma, it could be an infection, it could be a tumor. Or headache can be a symptom of many other medical conditions. You can have headache with a general infection. It's not unfrequent to see headaches in flu, in COVID. Certain medications can cause headaches as a side effects. Certain toxins can cause headaches.
How often do people have headaches and who suffers from them more?
So the two most frequent primary headache conditions are tension headache and migraine headache. And we think that the tension type headache prevalence is probably around 25%. And as far as migraine goes, it's probably somewhere around 12 to 14% worldwide. And there would be about 40 million people just in the US alone. So we see migraine headache is actually more frequent in women. So women are, 2, 3 times more likely to suffer from migraine than men.
What are the newer options for prevention and treatment, particularly for migraines?
Well, I think in the field of migraine treatment, we witnessed a real breakthrough over the last 5 years. A totally new class of medications just came up recently. In the past, we used to borrow a lot of medications from different fields. We used to use some anti-seizure medications, some blood pressure medications, and some antidepressants to treat our migraine patients. These days, however, we have a class of medications that is specifically designed to treat migraine. They target a peptide called CGRP that we think is involved in the pathophysiology of migraine. We currently have 3 different injectable medications. They can be injected just once a month. They have a very favorable side effect profile and usually are pretty well tolerated. We have one medication that can be administered intravenously. This is usually done at an infusion center once every 3 months. So those are used for the migraine prevention. Now we also have 3 new oral drugs. They do target the same peptide but have slightly different mechanism of action. And those can be used some of them can be used for migraine prevention, and some of them are used to treat acute migraine attacks.
What are rebound or medication overuse headaches? How can you prevent them?
Well, certainly, medication overuse headache, or we used to call it rebound headache, is something that we usually see in patients who have frequent headaches and have to use a lot of pain medications. So usually when patients use headache medications for more than 10 to 15 days out of a month, then it's not infrequent to see actual worsening of headaches instead of improvement. So the common types of medication that can use a medication overuse headache are our typical over-the-counter pills, such as non-steroidal anti-inflammatory medications, be it ibuprofen, naproxen, aspirin, or combination drugs such as Excedrin, but even drugs as simple as Tylenol, otherwise known as acetaminophen or paracetamol in certain countries. And also important to know that patients with chronic pains who are on opioid medications can also develop the medication overuse headache.
If you are having more frequent headaches, should you keep a diary?
Yes, we usually do encourage our patients to maintain a headache diary. And now with modern technologies, you can just use one of the applications on your phone. I think it is important to track not only the frequency and duration of your headaches, but also any potential triggers, as well as reaction to the medications.
When should you see a provider about your headaches?
I think it's appropriate to start with seeing your primary care doctor. They are usually pretty good with diagnosing basic headaches, providing the basic workup, and determining whether a patient needs to see a specialist or not. People usually come to see a headache specialist when there is a diagnostic uncertainty, headache has atypical features, when the headache becomes resistant to treatment, or progress and getting worse despite the treatment. Headache can be a sign of a medical emergency, so it is important to know when to seek immediate medical attention. Either call 911 or have one of your friends or family taking you to the closest emergency room. So one scenario is a very rapid onset of a new excruciating headache, something that people call the worst headache of their life. The clue here is that the headache reaches its peak intensity in less than 1 minute, something that we call a thunderclap headache. And this can be a sign of a serious medical condition like a brain bleed, a ruptured aneurysm, a blood clot, or an arterial dissection. Another scenario is when a headache is associated with what we call focal symptoms, when you have a new weakness in one part of your body or the entire half of your body, either weakness or numbness, or acute onset vision loss, or slurred speech, or difficulty with speech, or inability to understand. That can be a sign of a stroke. And finally, there are situations when the headache is associated with fever, and it might come with prominent neck rigidity or spasticity, and that can be a sign of a brain infection called meningitis.
Thank you for answering our questions, Dr. Shakouv. And for those of you watching, you're welcome to go to the web link below to learn more.